that simple. We send it off, it would be sent off by the UPS or FedEx. Okay, in North Carolina and Haywood County, we've had a state of emergency. We know North Carolina cases are, the transmission is classic. It's plane and car, it's travel. That's how it will arrive here, just by those means. We know where the outbreaks are occurring in the two big states, New York and Washington State. I tell people this all the time. Don't we think there are Haywood residents in some of those countries and some of those states? That's how it will arrive here. And I saw this, and I think we have to pay attention to this. If we don't pay attention to these mitigating factors, an epidemiologist, mathematician said, if we don't do these things, by the end of April, we could have as many as 1 million cases in the United States, and there's an R factor or a reproduction factor that doubles every 6 days. That would mean 5 days later, 2 million, 5 days later, 4 million. Right now, I think there's 3,800 cases in the United States, I think. Okay, let's see if in 6 days there's 7,600 cases. All right, and if every county, state is going through the same thing, the healthcare system and healthcare workers would be overwhelmed. That's why we have to slow the curve. That's the reason behind social distancing, to slow down the spread of the disease and reduce the severity on the people and the healthcare system. So this is my last slide, comfort and discomfort. We will get through this. We know we're going to get through this eventually through strong community partnerships and cooperations. The cooperations are vital for a coordinated, successful response that you, Kevin, know we've been started in Bryant, and Greg's going to talk about that coordinated response in a moment, but also discomfort. We need to be prepared for cases in Haywood County. Our citizens need to tolerate discomfort in the coming months in order to get through this. We need everyone to help respond to this emerging public health threat. Event cancellations are just the beginning of challenges we will be asked to endure. The first time I did these slides earlier last week, schools be closed, and then they were closed. That decision has many implications. Any child help. My message is don't panic and don't be complacent. We need to take this seriously. I think everyone has that message right now. I am asking people to help the health department staff by using that North Carolina coronavirus helpline, which is listed right there, to call that for questions. It's open 24/7. And if I could just say one more thing to help people. We need to turn off the media a little bit and relax and not get too overwhelmed by what we're hearing. We need to get outside and exercise, eat nutritious food, and get some sleep. It's just making a lot of people very panicked right now, and we don't need to panic. I appreciate the support everyone has given me. So after Greg, I'll be here for questions.
Thank you, Patrick. Upon notification that the county commissioners had developed a state of emergency, we activate our emergency action plans. And our plan includes, the first step is to create a policy group. We don't want a team of folks to be managing an emergency without guidance. And so that policy group has met a couple times, but including today, as early as 2:30 this afternoon, to give guidance to this team that we are forming to help the health director lay out this flattening the curve guidance that we're talking about. Some of the objectives that that were included and given and assigned to your team that's going to do this includes developing strategies or alternatives for this testing and screening process. Also, the sharing of information. We don't simply want to repeat CDC guidance. I think we've heard enough of that, and that's where I believe Patrick was talking about, kind of cutting off this national news type situation. We want to be able to give more detailed guidance to the restaurant owners. We want to give guidance to the medical community. We want to give guidance to law enforcement and public safety agencies so that they know what does that CDC guidance mean locally. I think that's what really matters, is how we take care of the communities. And that's the guidance that we have been given, and we're going to work hard to try to do those things. The most important thing that we're doing, though, is trying to engage the entire community. We've spoken with the hospitals. We've spoken with many of the faith-based organizations. We've tried to engage and empower those kind of folks, because we know when we engage the community, that's when we get the best sharing of information that we need for our community. Thank you.
Anybody have any questions for?
Is there anything you can foresee? I know Wake County is just now starting to see it. Is there anything you see on the EMS side of it? I know the fire departments aren't going to be coming to certain calls, and that's going to put an undue strain on your folks. Is there anything you need that you can see ahead of time?
That's a great question. And I think that by looking at some alternative strategies there, maybe sending out one person to community paramedics is one of the ideas that's been kicked around to do so. Also, additional part-time staffing to augment the staff that we have now happened today, and we're working on trying to beef up and make sure we have enough folks to work. So these are some of the things we're working on right now, but there could be other things that we should consider.
Well, I know from my background that a lot of times you just kind of do what you got to do as long as you need to do it. But if it starts becoming a burden and there's something we need to do, by all means, even though we're not having a meeting, you need to let some of us know so we can figure out something.
Thank you.
Maybe reach out to the local fire departments as well, or volunteer fire departments, and communicate with them. I've talked with a couple of them this past week, and they're willing to help any way they can, reaching out in their own communities. So I'm sure you will. I just wanted to mention that.
Thank you very much. We did have one conference call with them already, but that close communication is important. We're going to make sure we do that.
Okay, thank you.
And I think y'all were calling the restaurants, or health department was calling restaurants, I think.
Yeah, we sent out guidance. Environmental Health has a distribution list of 214 or 240 restaurants in Haywood County. We sent out guidance to them this afternoon.
Okay, good. So they've got that information. And I know the EMS I know EMS and HHSA have been fielding a ton of calls from citizens. And so we'll be setting up, I believe, a line for that, maybe, or.
The call, you're talking about your nurses.
Oh, yes. Well, we ended up getting 6 school nurses today. So we're having them help us monitor the phone calls. We're moving all of those calls that are coming through to us, and they're helping us manage them. If we can't answer them, we're moving them to that 1866 number. But we're answering the local calls the best we can. We're just taking them all right now.
And then Patrick, I know you talked about in their conference today about a drive-by clinic.
Yes.
Maybe, where was that at?
Okay, well, there's Mercy is having one at Flat Rock, I believe, tomorrow. And Pardee is having one in Hendersonville on Saturday. I've reached out to Mr. Harkleroad. If they are willing to do one, we would partner with them. The health department would do the business. We would be doing the guidance with anyone who is tested, and they would have to go through that criteria. If they are tested, then they would have to be put on isolation, and we would be taking over that part of the testing process. That's what's going on in those other drive-throughs. The private industry is doing the testing, and the health department is taking over the isolation business. And a person who is tested right now is if they're going through a drive-through, they're not going to be sick enough to be going straight to the hospital, more than likely. They're going to be told exactly, they drive to their home, they have to be self-isolated, and then we have to start monitoring them right away.
Okay, okay. Questions, Tom?
You know, I was privileged to sit in a meeting yesterday morning on Sunday morning. I don't know if Mr. Graham's still here, but the county staff's been doing an excellent job, some of the department heads and this task force you have in place. We were here nearly 3 hours yesterday morning discussing some contingency plans and getting Greg ramped up on what his department needs to do. But something that came out of the meeting on our haywoodcounty.gov website, our IT department has put a tab on the top left corner on the homepage, and it's a coronavirus update tab. I think Joey got that going, so it's very informative. He'll try to keep that up to date. And also, you know, something to communicate to your community. You know, the faith-based groups in our county are tremendous. I know I was in contact with my church today. Our secretary has got a phone tree program. Many community clubs, churches, and other organizations have phone tree programming on their messaging system. So she programmed all the shut-ins, the widows, our at-risk groups. I instructed her to send a phone tree message out to, you know, contact them, let them know we're concerned, and if there's anything we can do, if it's to transport them or carry them supplies, groceries, medicines of that nature. And I know our county can pull together and get through this. You know, I think you've communicated well about not panicking. This is a situation that's probably in our generation is probably something we haven't seen. But it's not unlike other national crises. You know, I think of World War II, I think of the polio crisis, I think smallpox, the Spanish flu in 1918, 1919. We're not walking down a road that's entirely new. Other people have gone through things of this nature. And I think we had a great president who actually suffered effects of polio. And I think of some very calming words he had for the people when he told the nation that the only thing we have to fear is fear itself. And when we got pulled into a world conflict at Pearl Harbor, we didn't want that. We don't want this. But we mobilized as a nation, and we pulled together, and we pooled our resources. Many people had to, you know, pay the ultimate price. But everybody pulled together and did what we needed to do as a nation. And I think we'll do as a county.